Ebola virus disease, formerly known as Ebola hemorrhagic fever, is a rare but severe, often fatal, illness in humans. The virus is transmitted to people from wild animals and spreads in the human population through human-to-human transmission. The average Ebola case fatality rate is around 50%. Community engagement is key to successfully controlling outbreaks. Good outbreak control relies on applying a package of interventions, namely case management, infection prevention and control practices, surveillance and contact tracing, a good laboratory service, safe and dignified burials and social mobilization. Vaccines to protect against Ebola have been developed and have been used to help control the spread of Ebola outbreaks in Guinea and in the Democratic Republic of the Congo, DRC. The incubation period, that is, the time interval from infection with the virus to onset of symptoms, is from 2 to 21 days. A person infected with Ebola cannot spread the disease until they develop symptoms. Symptoms of Ebola can be sudden and include fever, fatigue, muscle pain, headache, sore throat. This is followed by vomiting, diarrhea, rash, symptoms of impaired kidney and liver function, in some cases, both internal and external bleeding, for example, oozing from the gums, or blood in the stools. Laboratory findings include low white blood cell and platelet counts and elevated liver enzymes. Good outbreak control relies on applying a package of interventions, including case management, surveillance and contact tracing, a good laboratory service, safe burials and social mobilization. Community engagement is key to successfully controlling outbreaks. Raising awareness of risk factors for Ebola infection and protective measures that individuals can take is an effective way to reduce human transmission. Risk reduction messaging should focus on several factors: reducing the risk of wildlife to human transmission from contact with infected fruit, bats, monkeys, apes, forest antelope or porcupines, and the consumption of their raw meat. Animals should be handled with gloves and other appropriate protective clothing. Animal products should be thoroughly cooked before consumption, reducing the risk of human-to-human transmission from direct or close contact with people with Ebola symptoms, particularly with their bodily fluids. Gloves and appropriate personal protective equipment should be worn when taking care of ill patients. Regular hand washing is required after visiting patients in hospital, as well as after taking care of patients at home. Outbreak containment measures, including safe and dignified burial of the dead, identifying people who may have been in contact with someone infected with Ebola and monitoring their health for 21 days, the importance of separating the healthy from the sick to prevent further spread, and the importance of good hygiene and maintaining a clean environment. Reducing the risk of possible sexual transmission, based on further analysis of ongoing research and consideration by the WHO Advisory Group on the Ebola virus disease response. WHO recommends that male survivors of Ebola practice safer sex and hygiene for 12 months from onset of symptoms or until their semen tests negative twice for Ebola virus. Contact with body fluids should be avoided and washing with soap and water is recommended. WHO does not recommend isolation of male or female convalescent patients whose blood has been tested negative for Ebola virus. Reducing the risk of transmission from pregnancy-related fluids and tissue. Pregnant women who have survived Ebola disease need community support to enable them to attend frequent antenatal care visits to handle any pregnancy complications and meet their need for sexual and reproductive care and delivery in a safe way. This should be planned together with the Ebola and obstetric healthcare expertise. Pregnant women should always be respected in the sexual and reproductive health choices they make. Thanks for watching this video. Don't forget to click subscribe